Gentlemen, if you've been stretching your pelvic floor, hips, or lower body and the pain keeps coming back, you're not failing. We're probably just not addressing this properly. As a men's pelvic floor physiotherapist, I see men in the clinic all the time who assume that pelvic pain means they're simply too tight in their pelvis and they probably need to stretch more. And that's a fair assumption. You'd figure if you have tight quad muscles, it's easy to assume that stretching your quad will relieve the pressure in your leg. But in chronic pelvic pain, tightness is often not just a flexibility or muscle extensibility problem. It can be part of a protective pattern driven by the nervous system. When pain keeps showing up, the muscle may be operating in a state of a higher threat, and that means it can have higher resting tone, and it may not fully downshift after activity. It can become more reactive to things like posture, movement, stress, or even sensations from the bladder, bowel, or abdomen. So why does tightness come back after releasing or stretching? There's a few reasons. First, the autonomic nervous system may be upregulated. We've probably all heard of the fight or flight response, or in other words, an upregulated sympathetic nervous system. In men with chronic pelvic pain, these muscles can stay more guarded and less able to fully relax. The reason? We're often hyperfixated on the tension, constantly drawing our attention to the symptoms, or just stressing out about the situation altogether. Second, pelvic pain sensitization can keep this cycle going. In chronic pain, the nervous system can amplify threat and pain signals, which means even a muscle that feels a little bit better after releases may get retightened later by the protective output from the brain. Meaning, if the nervous system isn't relaxing, muscle tension might not go anywhere. Third, the brain can learn a default motor pattern. If the nervous system has gotten used to guarding, then even after a stretch or manual release, the muscle may return to its resting baseline because movement programming hasn't changed. Fourth, breathing matters. Shallow breathing or constant bracing can keep accessory muscles and pelvic floor muscles more active, which reinforces tension. Fifth, there can be a load capacity mismatch. If a muscle is asked to stabilize too much, too soon, or too often, it may tighten back up as a protective response. And finally, local tissue can still be irritable. True trigger points or sensitized tissue can remain mechanically and chemically reactive, so stretching may help temporarily without creating a lasting effect. So instead of saying stretching the pelvic floor doesn't work, a more precise way to say this is your nervous system may be keeping the muscle in a protective state, where it is over-recruiting, easier to trigger, and slower to settle after a release. That's why in pelvic pain, stretching alone often isn't enough. As a men's pelvic floor physiotherapist, and also as a man, I understand that we as men often want solutions and work relentlessly to achieve an end result. This is totally understandable, but sometimes it can work to our detriment. If we are so hyperfixated on achieving an end result during our stretching routine, sometimes we're just not allowing our nervous system to relax appropriately. Instead, my approach is to usually think about this in layers. To optimally address this, we need to focus on 3 things. Step 1, nervous system downtraining. One option is box breathing. It's a simple skill used to help down-regulate the nervous system by inhaling through the nose for 4 seconds, holding for 4 seconds, exhaling for 4 seconds, and then holding for another 4 seconds. Repeat this process for about 3 to 5 minutes. And remember how we talked about how shallow breathing can keep the pelvic floor muscles more active? This is because as we breathe through our belly, the diaphragm muscle descends, and we should be able to feel a subtle drop inside the muscles of the pelvic floor. With box breathing, we can often feel a slowing of the heart rate. And if this is done well, our thoughts can often be calm, neutral, and less fixated on the problem. The goal isn't to force relaxation, but it's to use our breath to give the body a slower and more predictable input so the system can come out of protection. Step 2 is myofascial self-releases. This can help reduce local sensitivity and calm the tissues. That might include a ball or a foam roller for the glutes, hip rotators, or adductors. A gentle external release for the pelvic floor using soft balls to release the perineum and surrounding pelvic floor muscles. If you take 2 soft balls and place them on the perineum, you can gently roll left, right, up, and down while remaining in a calm state. Whichever gentle release you use, you want to focus on slow, short, mindful sessions instead of rushed and fast ones. In the clinic, I usually recommend that men with chronic pelvic pain perform these short sessions for 5 minutes a day, multiple times throughout the day. Same thing for box breathing. 5 minutes a day, multiple times throughout the day. Step 3 is to be your own detective. You want to identify what factors are triggering your pain flares and nervous system upregulation. If you have poor sleep, this can lower your pain tolerance and make muscles feel tighter. If you're finding there are things in your personal life that are constantly causing stress, sometimes this needs to be addressed before you see any real improvement. You also want to find strategies to address your load management, meaning what are we doing that makes the pain worse? Is it sitting too long, lifting heavier things, or placing strain on your pelvic floor? If this is a load management problem, sometimes we need to combine myofascial release techniques with improving strength and stability at the core, low back, and hips. As you can tell, pelvic pain can be highly multifactorial, and paying close attention to what triggers your symptoms can often tell you about the things you need to do to fix it. So if stretching hasn't solved your pelvic pain, that doesn't mean you're beyond help. Your body just may need a broader approach. If you have chronic pelvic pain, what usually works is that combination of calming the nervous system and gradually rebuilding confidence through graded exposure. So if you like my content, please feel free to hit that like and subscribe button so we can keep showing this to more men who might need to see it. Thanks for watching.